you peel off this white paper. When you peel it off, make sure that this white paper, when you peel them off, it is properly kept, because you are going to use it to cover back the electrode pad to protect it. Now, you paste this wherever you want to treat, just like that, and that's how you do it. You place it the places you want to treat. We said you can see they are all connected to the pins, to the 4 pins. And now, firstly, we want to show you how to treat headache. The problem of headache. But firstly, I want to introduce you to the acupoints that are necessary for the placement of pad. First of all, you see the forehead here is one of the acupoints. Then at the lower part of the neck, this neck here, at the back, please bend. Neck here is another acupoint. Here is another acupoint. And here is another acupoint, because there are veins within those places that are connecting to the head tissue. Now we're going to place the parts in those places, on those places. Now watch how it is being placed. This is how it is being placed. You can see that I'm keeping these covers properly. Now, this is how it is being placed. Now you can see this is the right way to place the pad for the treatment of headache. You can see the one at the back, how it is placed. So this treatment, you apply acupuncture for 1 to 3 days. 1 to 3 days. Why 1 to 3 days? Sometimes you could just apply it and the headache is gone. But where it persists, especially migraine or serious headache, you treat for like 1 to 3 days each time, and for 5 minutes. 5 minutes, and you use not more than 2 intensities, as explained on the machine, usage of the machine. The intensity shouldn't be more than 2. Show you how to treat arthritis. If, for instance, some people suffer arthritis on both legs, it is advisable that you treat each leg separately. You don't place 2 here and place 2 here. It is safer and better to first of all treat one. This is how you place the pad. You place one here. You place another here. Then you place another one here. Then another one here. That's how to place the pad for the treatment of arthritis. For arthritis, you use the treatments acupuncture and manipulation. Again, acupuncture and manipulation. You use them 15 minutes each for 30. There's 30 minutes in all. 15 minutes each. 15 minutes of acupuncture, 15 minutes of manipulation, making 30 minutes in all. And this is done for 30 days. It is done for 30 days. Note that if you have a mild arthritis, before you get to even 15 or 20 days, it may have cleared. But for those chronic ones, you just have to continue for 30 days. And that is the treatment cycle for such. Whereby you treat for 30 days and you're still feeling some little symptoms, you allow it for another 5 days. You keep it free from another 5 days before you start another phase of treatment. And that phase of treatment might take you just like 10 days or 15 days. Demonstrate how to treat stroke function. How to treat stroke. Now, in treatment of stroke, you know that partial stroke, you know that sometimes it is a certain part of somebody, one part of an individual is not functioning well. That part that is not functioning well, that's where you are going to treat. First of all, we'll talk about the acupoints. Here, you notice this ankle, this arm here on the shoulder joint here. This side here at the back is an acupoint. Here too is an acupoint. Then this place is another acupoint, and also here is another acupoint. So these are the places we are going to place the parts. Now this is one of the acupoints. This another acupoint. Then this side, is another acupoint. Then here at the back here is another acupoint at the back of the arms there. What we use here is stroke function. You move to stroke function. You move to stroke function. You move to stroke function. Then when you move to stroke function, you select, it is treated for 10 minutes for each point. This is a point. This point, you treat it for 10 minutes. You treat it for 10 minutes for 50 days. 10 minutes for 50 days. But if you so desire to treat it because of the intensity of the stroke, you want to treat it for 20 minutes, it's still okay. You can go ahead and do that. But basically, the treatment for stroke is for 50 days. Then for the leg part of the stroke, we also have some acupoints. This is where to place the parts for stroke. At the arm, the part of the arm, one side of the arm. Like you on the machine, you scroll to stroke function. It's 10 minutes. You take it to 10 minutes. Then this is the intensity, strong. You begin to press 1, 2, 3, 4, 5, 6, 7, 8. Now this is how it works. If you notice, if you look properly, you will see how it's checking the hand. Now this is the treatment for stroke. This is how you can see how the body is reacting to it. You can see it. You can see that. You can see how it's checking her. So if it is too much for you, we'll go to weak and begin to reduce it gradually until it stabilizes on the body. Absolutely. We will now go to the leg side of the stroke function. Treating stroke on the leg, these are the places you place the pad, and this part we are also, but because of inconveniences, we can't really place it on the hip. Basically, this side is one of the acupoints. It should be placed on this part of the body at the joint level, within the hip, and also somewhere at the lap here. So when you do that, you repeat the treatment just as we did on the side of the hand. We will go into the next treatment function now. Treatment of blood pressure and low blood pressure. These are the ways you treat it. This is an acupoint, and this place is another acupoint. Because why? Here, because there are arteries here that are directly connected to the heart region. So now, and being the fact that this electro pad treats directly the nerves inside, that's why it has reaction on it. Then these are the various acupoints. Whether high or low blood pressure, this is how to treat it. You place the pads at this acupoint. What it does is that if it is high blood pressure, it regulates it to normal. If it is low, it also regulates it to normal. The treatment function used for this treatment is called acupuncture and immunotherapy. If you see, you will see the first one here, acupuncture, where the arrow is pointed at. Then the next one is immunotherapy. We keep scrolling. Immunotherapy, you can see the last one on the left. The last one on the left. Now, it is used, we'll go back to acupuncture. First of all, we use acupuncture for 15 minutes. Then immunotherapy for another 15 minutes. Altogether, 30 minutes at once each day for 30 days. And this is how it goes. And so when you are applying it, you select it. It's already on 15 minutes. Then we'll press strong to start. Intensity, you press it on 2 intensity. You can see the effect on her. You can see the effect, how it's working on her. You can see how it's working on her. As it's working, it is working inside the nerves. It's treating those nerves and arteries that are connected to the heart. It is expanding the blood vessels. So that is how it works for that. Then if it is also much for the body to absorb, you use weak to reduce the intensity. I want you also to note that in boosting the immune system, this is how the pad is also placed. But the only difference is that you use only immunotherapy. Immunotherapy is used to boost the immune system. You apply immunotherapy for 15 minutes for 15 days. 15 minutes for each treatment for 15 days. This is immunotherapy. You see, I apply it. You see the arrow is blinking. You can see the effect on her. What is it? So, okay, that's how the machine works for immunotherapy. Immunotherapy means immune therapy. Immune therapy, meaning that it is a treatment for boosting the immune system. So that is how it works. You can see it, it boosts the immune system. It helps the circulation of blood, energizes the blood, increasing the pulse level of the blood system, the nerves. That's how it works. And we'll move over to the next treatment of obesity, that is excess tummy, both in men and in women. This is how to place the pad. And what we use for this is scraping function. And this scraping function can be used for 30 minutes for each treatment for 30 days. It can be used 30 minutes. You first set the timing to 15 minutes. When it goes off, you set it for another 15 minutes. That completes the 30 minutes. Then it is for 30 days or more. 30 days or more, depending on the progress you're making with it. Now, scraping, this is how it works on the body. You can see that's the effect, how it works on the body. It looks like it's sucking out the fat. Then if it is excess cholesterol, this is the position and the same treatment pattern for obesity, excess fat in the stomach or intestine, cholesterol in the intestine. This is how to place it. And that is how the same treatment function is applied. And when you do it, it will shake off all the excess fats and cholesterol in the intestine. It works on it and takes care of it all. And note, I want you to note something. When you are undergoing this type of treatment, there will be a time you notice like you want to pass out excrete. It is normal. You can pass out excrete after the treatment, or after the treatment you might be feeling like you are gassing, gassing, polluted. It's not an offensive pollute, but it's more or less you're passing out gas, from the intestine after this treatment. That's how it works. Notice that we are going to treat for constipation, for stomach ache, and abdominal problems. For each of these, stomach ache, abdominal problems, and constipation, this is how the pad is going to be placed. But the different thing is that we are going to use a different treatment function called acupuncture. And this is used for 15 minutes each day for 10 days for stomach ache, constipation, and abdominal problems. Now, for constipation, when you're also taking this treatment, what you do is you also take enough of water and fruits to help while you're taking the treatment. That is for constipation. Now, for this treatment, like I said, 15 minutes for 10 days using acupuncture treatment, and this is how it goes. You notice that the reaction is quite different from when we are treating for stroke. For acupuncture, for constipation, stomach ache, and abdominal issues we are treating, you notice it goes gently, gradually, picking out those things and treating it. The way it functions, the way it reacts on the body is different from the way the scraping function for excess cholesterol on all that functions. We will now move to the next treatment function for waist pain. These are the acupoints where you place the pads for waist pain. Waist pain, the treatment function we use is called manipulation. Manipulation is used to treat waist pain, and the treatment period is for 10 to 15 days, 30 minutes per day. You first of all use 15 minutes. You use manipulation 15 minutes. After the 15 minutes elapses, you come back, apply it for another 15 minutes. That is 30 minutes for each day for 10 to 15 days. This is how the treatment function works. It might not necessarily vibrate on the outside, but on the inside it is working. So we'll move to the next treatment function. For general pains of the body, these are the places, the acupoints where you place the pads. And also for fatigue, at the end of the day's work, you are back and you're feeling tired, tensed. You can use this means to ease up the tension within you. What the treatment function you use is acupuncture and massage. You use acupuncture 15 minutes, massage 15 minutes, acupuncture 15 minutes, massage 15 minutes, 30 minutes in all. You can apply this for up to 15 to 20 days, or anytime you feel fatigue at the end of the day's activity or you feel body pains, you apply it in this format. We'll move to the next treatment function. For shoulder pain, these are the places you place the acupoint. There are two ways you can place the pad. Two ways. This is how you place it. This is the first way to place it. You treat. And what you use is acupuncture, 15 minutes. Acupuncture treatment, 15 minutes for 10 days. 15 minutes for 10 days. Okay. You can see the reaction on the body, on the shoulder. You can see it. You can see the reaction. That's how it works. And like I said earlier, this is the first way to place the pad for the acupoint. Then let us now take a look at the second part of the acupoint, how to place the pads. Now this is the second way of placing the pads for shoulder pain. This is the second way of placing the pads. You use the same treatment, acupuncture, 15 minutes for 10 days. So that's how it works. We'll move to the next treatment function. We're going to look at treatment of a toothache. Treatment of toothache, this is how to place the pads. Close to the jaw, here the tooth is. Then we also place it here. I want you to note something, that even as we treat the toothache, this too here is an acupoint that connects to the eyes. It works not only the treatment of toothache, but it also massages the eyes and help to, keep the eyes fit. And this treatment is done using massage and acupuncture. Massage and acupuncture. You use massage for 10 minutes, then acupuncture for another 10 minutes. That's 20 minutes. You do this once a day for 10 days. Once a day for 10 days. Now we'll move to the next treatment. This is how it is displayed on the body, using massage for the first 10 minutes. For the first 10 minutes, you can see how it's working on her. You can see the effect on her body. You can see the effect. You can see how it's moving the mouth. You can see it. You can see what it's doing to the mouth. That's how it works. It's treating the teeth. You can see it. That's how it works. Stiff neck. For the treatment of stiff neck, this is how it is treated. Then stiff neck occurs when, for instance, you wake up from bed, or you probably, while sleeping at night, you did not sleep. This is for the treatment of stiff neck. Stiff neck can occur when during at night you may have slept in a wrong position, and waking up in the morning, your neck is painful. You can't turn your neck is stiff with pains. This is how to take care of it and treat it. You place the pads at these regions. These are the acupoints at these regions. That's how to place it around the neck. Then the treatment function you use is called coping function. 15 minutes. Coping functions, you use it 15 minutes for 5 days. 15 minutes. Coping function is what you use. You can see the reaction on the body. It's directly working on the neck, relieving of the pains. But that's how it works. You can see that. You can see that's how it works. That's how it works to treat the stiff neck.